Welcome to Findata's application clinic. My name is Sonja Salorantavest and I'm a senior specialist here at Findata.
Hi, my name is Paula Nurmi and I am also a senior specialist at Findata.
Today we will be talking about the Finnish healthcare system and health data registers in Finland. We will also guide you to our help desk and other helpful tools, as well as going through what you need to know before sending an application to Findata and what we mean with extraction descriptions. And we will also talk about what to expect when you receive your data.
And we'll begin with a short introduction to Findata. So we are a centralized data permit authority for the secondary use of Finnish social and healthcare data. We are positioned in the Finnish Institute for Health and Welfare, and we are steered by the Ministry of Social Affairs and Health in Finland. And our operations are based on the National Act on Secondary Use of Health and Social Data. Findata has been founded in 2019. And what we do is we aim to improve the access to Finnish very rich nationwide health and social data, but at the same time enhance data security and data protection for individuals whose data is being used. Our key services entail, of course, issuing permits for the secondary use of social and healthcare data. Then we collect, once we have issued a permit, we collect, link and pseudonymize or anonymize the data that has been issued a permit for. And we also have our own secure remote access environment for data analysis, and it is called Kapseli. Of course, we have help desk services covering all our services. And then we may also process applications and permits on behalf of other data controllers if they wish so. And then we support on a national level the preparation of data descriptions. Then let's have a look at the Finnish healthcare system and health data registers. Our healthcare system is based on public healthcare that is provided by 21 well-being services countries, the city of Helsinki, HUS Group, and the Åland Islands. And these well-being services countries are self-governing organizations that are funded by the state, and they are responsible for organizing a very wide range of services, including both primary and specialized healthcare, social services, mental health and substance abuse services, family and disability services, rescue operations, and emergency care. And to complement the quite extensive public healthcare available in Finland, we also have private health services provided by independent or private companies or independent practitioners, organizations, and foundations. And commonly used private healthcare services include general care, occupational healthcare, physiotherapy, oral health services. And private healthcare can include both primary and specialized medical care. And it has been estimated that around 1 in 5 persons in Finland chooses to buy a private health insurance and then uses these private services. And what is a little bit peculiar about Finland is that we have occupational healthcare. So all employers are required to provide preventive occupational basic healthcare services for their employees. And these services, they aim to promote occupational health and the safety of work and the working environment, and also to prevent occupational diseases. And on top of these basic occupational healthcare services, many employers also arrange medical care for their employees, even though this is not mandatory by law. And these occupational health services are typically purchased from private healthcare providers. And then data from all of these 3 different entities are recorded in the caregiver's own patient records, but also in the National Care Register and in the Kanta patient repository. Then on top of the care providers registers, we have many national data controllers. To name a few that are very widely used for secondary use purposes, the Finnish Institute for Health and Welfare, THL, has a platitude of thematic health registers, such as, for example, the Finnish Cancer Register, Vaccinations Register, Register for Medical Births, and so on. Then data on social insurance is available from the Social Insurance Institution of Finland, for example, all social benefits, but Kela also has records on all prescribed and dispensed medications, and the Kanta services I already mentioned. And then, for example, Statistics Finland keeps a record of all causes of death. So data on deaths is comprehensively available from Statistics Finland. In Finland, every person that is registered here has a unique personal identity code. In Finnish, it's called henkilötunnus. We also often refer to it as hetu. And data in all different registers across the society are entered based on this unique ID, and this makes it possible to link data originating from different registries or the data is interlinkable using this one unique ID. Then a few words about Findata's help desk services and other helpful tools. So who should you contact if you need advice? If you need advice on general information about the secondary use of health and social data, or information on Findata's services or applications submitted to us or Kapseli, then please contact us directly. But if you need assistance in with matters related to availability of data or data contents of different registers, we advise you to get in contact directly with the data controllers, because they are the experts when it comes to data available in their registers. So we're here to help you with Findata services, and the data controllers will help you with any questions related to the data or metadata. Our help desk comprises of, of course, we have a web page with a lot of information, but we have also built a data assistant, and that tool is created to help you identify the relevant data controllers and registers for your project. We have an application assistant, and this tool is designed to evaluate the correct authority who to submit your application to. And then we have a training portal that has more in-depth information on different topics, for example, the Finnish healthcare system and available data. And on top of that, we also have created some videos illustrating the application process.
And we will have a look at some of these tools later on.
Yes. To contact us, you can always email us at info@findata.fi, but you are also very welcome to book a personal appointment, findata.fi/booking, or you can join an application clinic webinar. Then for more information on data available in different registers, in Finland, all the data controllers are obliged by law to describe their data into a metadata catalog, the data resources catalog. And this webpage is designed to help you understand what data on a variable level are available in which registers and data sets. So please also have a look at that data resources catalog. Then let's have a look at what you need to know before you can submit your application?
Thank you. So before you start filling in an application, make sure that it's the correct application type. When you send an application to Findata, it can either be for individual level data, and this application is called a data permit application. In this case, we will remove all direct identifiers from your individual level data and make it available for you in a secure operating environment. And these are for purposes specified in the Secondary Use Act, for example, scientific research. But you can also send us a data request, and with this you will receive aggregated data or anonymous statistical level data. And this we will send to you directly, since it doesn't contain any personal data anymore. And all permits are always granted for a specific purpose, a specific time period. And if it's about individual level data, we will also name the persons who can access the data in the secure environment. So when your data permit application concerns several public, social and health sector data controllers, private service providers, the Kanta services, or in some other special situations, such as controllers who have transferred their jurisdiction to Findata and Findata's own ready-made datasets. In these cases, you need to send your application to Findata. And also in all data requests, the address is Findata. But if you then want to apply for individual level data from only one controller, it's usually directly to the controller that you need to apply. And if you are unsure, you're welcome to contact us and we will sort it out, and you can use our application assistant, of course. So, what happens when you send a data permit application to Findata? Even before, we advise you to contact the controllers, because they will give you valuable information and possibly also cost estimates even beforehand. And this is something that we will then get back to when we process your application. But when you have submitted it, we will first review your application and have a meeting together with you online to go through it together and then possibly ask you for more information. Once everything looks clear, Findata will then send cost estimate requests to the data controllers, and at the same time ask them for any comments on availability, for example. Once we have received answers from all controllers, we will estimate Findata's part of the data processing, and then give you all the information about costs and the final versions of your data extraction descriptions. And we ask you to approve the content of your decision before we make your permit. Findata is an authority, so we decide on your application. It's not about a contract, but we have non-negotiable conditions to the permit. And in normal cases, we will process your application in 1 to 3 months. Then after the permit, we will send data extraction requests to the controllers. So we will ask the organizations to then actually extract the data. And they have 30 working days to submit the data back to us. And then we pre-process it. So we remove any direct identifiers and pseudonymize the data. So in the end, you will not have access to any personal identity codes or names or data like that, but pseudo IDs, which make it possible for you to combine persons between data sets. Then we release the data to you in a secure processing environment. After you receive the data, it's important that you check it within 3 months, and if there are any issues, get back to us, and then we will have a look at if there is anything that needs to be corrected. because after these 3 months we will delete our copy of the data, and after that it will be very difficult to go back and see what has happened. So you are getting ready to fill in your application. This is what you need to think about beforehand. You need to know who is the applicant and who is the contact person. And usually the contact person will be you, and the applicant, the organization that you work for. That's a very, very usual scenario. You will need to define who is the data controller of the data set you are applying for. And in most cases, this is the same organization as the applicant organization. And we also ask you to define who will pay in the end. You need to identify the purpose of data use. For many of you, it will be scientific research. And in this case, we need to see your research plan as an attachment. And if you have any other research permits, data permits, or for example, an ethics committee statement, please add those to your application. Then the data that you are applying for, we need to see descriptions of what kind of data extractions you are planning. And for this we have a form, and we will have a closer look at that later on. But we ask you to define the controller, the registers, and the variables. Then you may have some other data sets already that you wish to combine, so we ask you to attach those permits as well. And then you need to think about data processing. In which secure processing environment do you want to receive the data? And think about data protection, which is usually pseudonymization, but also your other data controller duties. Then in which countries will you be processing the data? Is there any country outside the EU, EEA? Please mention that to us. And have you made a data protection impact assessment? Please attach it as well. And think about if there is any need to store data after your project has been completed. Your budget is something you need to think about as well. From Findata, we will charge you a decision fee for your permit, but the biggest part of the cost is usually the data holders' extraction costs, and then our data processing fees. And these depend completely on what data you are applying for. And during the application processing, we will ask for maximum cost estimates. So these will be clear to you before you get your permit, but it's also a good idea to discuss fees with the data controllers even before submitting the application if you're unsure of the budget. Then depending on the secure operating environment, there may be costs also for the use of that environment. The extraction descriptions. When you think about the data set that you are applying for, consider which registers are interesting to you, which registers hold the data that could answer your research questions, and who is the controller of those registers. Then think about your target group. From which register do you need to identify the people that you are studying, and be precise when you plan your target group. Do you need any controls? Do you need any relatives? Where can you find them? How should they be defined? Think about all of these details. And then the actual data, which are the registers and which are the variables that are useful to you. And always keep the data minimization principle in mind. So don't apply for data that could potentially be useful, but be really precise and minimize.
And the data resources catalog is a really helpful tool for
Absolutely.
making these descriptions, because you can find out the actual registers, names of data sets and variables available, and also
Yes.
limitations for time frames and so on.
Precisely. And in your extraction description form, we also ask you to mention in which order the extractions will be made. And maybe most important is to think that you need to have your target group before you can extract data for your target group. And for each extraction, always the date ranges. And now we come to the extraction description form, and we find this a really useful tool to describe extractions. So first we have the order. In step 1, we will request the target population. In this example, it's being extracted by THL, the Institute for Health and Welfare, and they will deliver that data to us. In practice, it's the personal identity code at this point. And then in step 2, we will send the target group to several controllers who will then extract data, and in this case more variables, so the actual research data at this point, and they will deliver them back to Findata. Then we pseudonymize it and release the data to a secure operating environment.
And if my project needed, for example, control population for the target population, then I should add that as step 2, and then the actual data extraction would be in step 3.
Yes. So they should be tailored to your project, but in clear steps. And on the right-hand side, you can also see the maximum time for each step. So for each extraction, the controllers have 30 days according to the Act. So this gives you an idea also of how long the data formation will take. And this is an example of an extraction description for the target group extraction. So we're talking about step 1, and in this example, the register is the Institute for Health and Welfare's CARE register. In this example, applicant has estimated that this is about a 400,000 person target group, and this is important so that Findata and the controller and the applicant have a similar idea of how many people we're talking about. And then if some data set is clearly bigger or smaller, we can identify that in an early phase and then maybe correct it before all the data has been extracted. In this form, there's also a place for the date range and how that should be delimited, and also which extraction limitations are used. In this example, we are extracting people who have a main diagnosis of type 2 diabetes, and they are also at least 18 years old. And since we're identifying people, we're only extracting the personal identity code. And this is a step 2 extraction example, and it's the same form, but here in this case, the target group has already been identified, and we mentioned that Findata will provide the personal identity codes. We're still in the same register, the CARE register, but you can see that the date range is different. So here we're applying for data for a longer period of time. And also the variables look different, because here we have several actual data variables. So we get information about the care, such as diagnosis and operations and dates for these. All right, now we're at the end. You are close to receiving your data. What should you expect? So when you have your data permits, you will receive individual level data. Findata has pseudonymized it, but we will not otherwise combine your data in any way. So prepare to receive numerous different files. But you can, of course, link these files together because each individual person has been pseudonymized with the same ID. So instead of personal identity codes, you have unique IDs. specific for your project. We always ask the data controllers to also deliver a data description together with the data, so you will get some metadata as well to help you get started. And generally, the data is released in CSV format, but that of course depends on what kind of data you have. Images will look different, of course. A few words about the secure processing environment. So if you receive individual level data, you will only access it in a secure processing environment. And at the moment, there are 10 different options of audited environments, and Findata has one called Kapseli, which is a really good option for you. These environments can be accessed via your own computer, via the browser, but there's no internet connection and you can't import or export anything yourself. But there's software available for you to analysis. And then when you have your anonymous results ready, you can export them via Findata. A lot of data is available via us, but you can also combine data that is available under different acts. For example, biobank data, data from Statistics Finland, or from other controllers, or from other countries as well. And in this case, you need to apply for a separate permit and then mention it to us that this is something that you wish to combine. And at the end, 5 tips for speeding up your application processing. And the first one is to check that you're sending your application to the right place. This will save you a lot of time. Also selecting the correct application type. Number 3, describe and define the data you need. If you are well prepared, so you know what is available, what you should apply for, and you have described this well, this will be a real time saver as well. Confirm your budget. This will make life a lot easier for you. And number 5, complete the application carefully, because everything we ask for in the application form is something that we need to have. So if you haven't filled it out carefully, we will definitely ask for it later. And here we have gathered some useful links. On our website, there's a lot of information about how to plan your application, how to fill in the application, about pricing and instructions and checklists. And the Office of the Data Protection Ombudsman has really great information about data processing and information for controllers. The data resources catalog is an asset, and also the data controller's own websites and help desks. And now we will take a closer look at some of these tools.
Yes. Okay, so now let's have a look at the help desk tools that we mentioned already in the presentation. I can show you the data assistant first. So let's have a look at it. You can find it on our webpage, and this tool is designed to help you identify or find those registers that hold the data that you need in your specific project. So we have divided different data into categories. So what you need to do is choose the data category you are interested in, and then whether you need national level data or regional level data. So let's make a small exercise now with this tool. What data category are you interested in?
Let's have a look at medications and patient care events on a national level.
Okay, so we'll choose medications and patient care events, and then choose the national level. And as a result, this tool gives us information on relevant registers. For example, for national level medication data, you might be interested in the Kanta Services prescriptions register that has all prescribed and dispensed medicines, but also for example, if you're interested in drug reimbursements, there is a special register for that. So you can see what registers are related to medications are available. And then for national level patient care event data, you might be interested in the care register for the Finnish Institute of Health and Welfare, or in the Kanta patient repository. And then you can go to the data resources catalog and find out more information about these registers. So if you have, now we're in the data resources catalog, and if we choose the Finnish Institute for Health and Welfare, and then we will find the care register. So this was the national care register. And then you can see the actual data sets available in these registers, the reference dates, coverage information, and then the actual variables available from this data set. So these
and here you can also download all the variables as a CSV file.
Yes, be sure to change the language to English if you want it in English. Yes.
Brilliant.
And then, do you want to show us the application assistant?
Yes, let's. So with the application assistant, you will find out the correct authority to send your application to. And let's stay with these same examples. So we want care event information from the Finnish Institute for Health and Welfare, and then medication data from the social insurance institution. So you click in the data controllers whose data you're applying for, and then let's see what the application assistant tells us. In this case, you should apply for your data permit from Findata. And the application assistant will also give you a brief explanation of why. We can check with another example. For example, one single public service provider of healthcare. For example, One Wellbeing Services County. And in this case, the application tells you that you should apply directly to the controller in question. And there are some special situations. So if you are unsure, just send us an email and we will help you forward.
But yeah, seems like a good tool
Very
to find
helpful.
out the correct authority.
And then the final tool that we will have a look at today is our training portal. And at the moment we have one available training in the portal, but we are developing several more. And this first one concerns the Finnish healthcare system and health data registers in Finland. This will give you a good overview of the public healthcare system in Finland, as well as of the private and occupational healthcare. And then we will go into some of the mostly used health data registers. And in the end, you will have a summary and a quiz. And you don't need to enroll for this training, but it's freely available on our website. Thank you for joining this application clinic, and we hope that there has been some new useful information for you and that you're now ready to start filling in your application or planning your application. And if there's anything that you're wondering about, you're welcome to send us an email or book a personal consultation and we will help you out.
Yes, thanks for watching. Bye.
Bye.